welcome back to A to Z Dentistry, a channel which features easy explanation of various dental topics. And our today's topic is osseous craters. So without any further delay, let's get started. So today we will be studying about osseous craters under three main headings. That is, we'll be looking at the definition of osseous craters, followed by clinical features and the treatment undertaken for the same. So let's begin. So, by definition, osseous craters are concavities in the crest of the interdental bone, which are confined within the facial and the lingual walls. So, we know that osseous craters are basically a type of bony defect which is present, right? So, the shape of this bony defect is it's like a concavity, right? That means it's something which is similar to shape of a saucer, right? And these are present within the crest of the interdental bone. Now, interdental bone is something which lies between two teeth, right? That is the interdental bone. And these concavities are present within the crest of that interdental bone. However, the thing here to remember is that these are confined within the facial and the lingual walls only. This won't extend into the mesial or distal walls, right? So this is the definition about osseous craters. So in this figure, we can see figure A is structure of the normal interdental bone which is present, and in the B we can see there is a scoop-like shape, that is there's a saucer shaped which is there. This is nothing but the osseous crater. Talking about the clinical features, so our first clinical feature would be the location, right? So where are these craters located, right? So these craters are basically found in up to 1/3 of the percent of the defects, right? They constituent about 35.2% of all the periodontal defects or the bony defects which are present, and about 2/3 of this defect, that is about 62% of this defect, are largely confined to the mandibular teeth, right? So they occur twice as often in the posterior segment when compared to anterior segment. That is, the posterior teeth are more likely to have such kind of defect when compared to anterior teeth. Okay. So another important point as far as the osseous craters are present is that the height of the facial and the lingual crest of the crater is identical in about 85% of the cases. That means the hollowing or the saucerization which is happening along the facial and lingual crest, the amount of bone loss is somewhat equal, right, in about 85% of the cases. And in remaining 15% of the cases, it is equally divided between higher facial heights when and higher lingual heights. That is, in some of the cases, the facial crest might have a higher height as compared to that of lingual crest, and vice versa, right? So these things you need to mention in your answer, right? So whenever a question that is a short answer question is asked for osseous crater, you need to describe it, that is the location, and these are found more commonly in the posterior segments. Then what is the difference between the heights, right? And also you can draw this diagram which I have put up for the reference. Here you can see there is a hollowing or the concavity, and the facial and the lingual crests are also visible. In the same diagram, you can show that in 85% of the cases, the height is identical, whereas in remaining 15% of the cases, maybe the facial height would be more, and in some cases, the lingual height could also be more, right? So this is all which you need to describe. So for 3 marks, at least you need to write one page answer, right? So you need to describe such points in detail. So previously we have learned that about 35% of the bony defect cases are osseous craters, and in mandibular it is about 63% defects, right? Which are composed mainly of osseous craters. So why are these craters so common, right? So there are a few reasons which are described in various books which tell us that why these defects are so common. So let's dive into it in detail. So there are three chief reasons which have been attributed for the higher frequency of interdental craters, right? So the first one is that the interdental area is quite difficult to cleanse by our normal oral hygiene procedures, and also it collects plaque, right? So what happens as this area is already susceptible for collection of plaque, as well as the oral hygiene is quite cumbersome to maintain in that area for most of the patients, so this area is particularly liable for interdental crater formation. Next reason is that there's a slightly concave shape, right? it is somewhat normal. However, it is slightly concave, the shape which is present on the facial lingual aspect of the interdental septum, particularly in the lower mandibular teeth. And this particular shape, that is the physiologic shape which is already present there, makes it favorable for the crater formation in that particular region, right? So you might get an MCQ wherein you are asked like which area is particularly susceptible for occurrence of interdental craters. So that would be mandibular molars, right? The third pattern is that there is a vascular pattern, right? Which is, it is somewhat that it favors the crater formation there, right? So the vascular patterns from the gingiva to the center of the crest are somewhat tortuous and which makes it susceptible for the crater formation, right? So there are three chief reasons, right? The first one is the oral hygiene is quite cumbersome to maintain in that interdental area. It is difficult to clean, therefore it is more liable for crater formation. Second is that there is a slightly concave facial lingual shape in the lower molars, right? Especially in the interdental septal area. Therefore, the craters are more likely to occur in that area. Third is the tortuous or the coiled pattern of the vascular supply from the gingiva to the center of the crest, right? So this altered vascular pattern also favors crater formation. I hope you have understood these three reasons, right? As these are very important, you need to mention these three reasons in your answer as well. Moving on towards the diagnosis part, as in how can you diagnose a case of interdental crater, right? So the chief diagnostic modality would definitely be an IOP, interperiapical radiograph, right? So in that you can see that there is a saucerization or the hollowing of the bone which is happening, right? A shape which is somewhat saucer shape, there you can suspect a bony defect, right? Alternative would obviously be an OPG, and still higher modality would be a CBCT in order to determine the exact amount of defect, that is the bone loss which has occurred along the facial and the lingual walls, right? So here in this picture you can see that there's a saucerization which is happening, right, in the anteriors, that is two central incisors. So this is nothing but this is the crater formation. You can see that there is amount of bone loss which is happening on the facial and the lingual wall. This is nothing but this is the crater formation which is there. Next image we have an OPG, right? Here also you can see the arrow is pointing towards the saucerization or the hollowing of the bone which has occurred. This is nothing but this particular osseous defect is your interdental crater which is here. Moving on towards the last part, that is the treatment. So once you have diagnosed a case of an osseous crater, how are you supposed to treat it, right? And also whenever you are writing an answer, a short answer or a long answer question, you need to remember that you need to write it in points, right? So we have up till described everything starting from the introductory part towards why craters are so common and everything. Lastly, you can mention in 2 or 3 lines about the treatment which is undertaken for such bony defect, right? So the treatment part of osseous crater mainly consists of the osseous resection surgery, right? So the name itself indicates osseous means bone, resection means we are cutting out a part, and this is a surgical procedure, right? So we are undertaking an osseous resection surgery. Now let's have a brief overview about as to what osseous resective surgery consists of. So the first part of osseous resection surgery would consist of vertical grooving. So in this picture, we can see that there are vertical grooves which are placed, right? So this step is usually done with the help of burrs, right? With the help of burrs, we are putting grooves in the bone, and these are in a vertical direction, right? We are not putting them horizontally. Therefore, we are firstly doing the vertical grooving. So once we have put up those vertical grooves within the bone, our next step would be radicular blending. That is, we need to blend all those grooves which we have created. We need to flatten them out. We need to even them out. And this step is known as radicular blending, right? It is not bending, it's blending. That means we are blending all the portion we have created the grooves, right? So we need to blend them so that whole of the bone is in the same plane, right? Next is flattening of the interproximal bone. Now, in the first step, we have seen that we have put up various vertical grooves. So, what happens? The interproximal bone is not reduced at a proper height, right? So, we are reducing the area on which we have put up the grooves. Now, there is an amount of interproximal bone which needs flattening too. Overall, what we are creating is we are making a entire bone in the same plane, right? We need to have a flat bone, a flat plane, right? So therefore, first we put up grooves for our reference. Next, we are blending them, and also we need to flatten the interproximal bone. Here we can see there is interproximal bone which is present between two teeth, and we are flattening it out, right? That is the next step. So the last step of osseous resective surgery would be gradualizing the marginal bone, right? So here what we are doing, we are just gradualizing all the marginal bone which is left over in that place, right? So we started with placement of some vertical grooves, right? Then we flattened out all the irregular bony edges which were present, right? Then also we need to flatten out the interproximal bone which is present, right? That is vertical grooving, radicular blending, flattening of the interproximal bone, and our last step would be gradualizing the marginal bone. So whatever marginal bone is left, right, in the circumference of the tooth, we need to gradualize it. That means we are making whole of the bone in the same plane. So whenever we say there is a bony defect, it basically means that there is some amount of irregularity due to some underlying periodontal condition which has occurred within the bone, right? So in order to treat the patient, what we need to do, we need to gradualize all that bone, right? We need to make whole of the alveolar bone in the same plane. Only then the healing can occur, right? So the last step is nothing but gradualizing the marginal bone. So let's have a quick recap of what we have studied so far, right? So we started with the definition. So by definition, osseous craters are basically concavities which lie in the crest of interdental bone and which are confined within the facial and the lingual walls, right? So you might be asked an MCQ as well from this particular definition, that on which walls could we find craters. So these are located only within the facial and the lingual walls, right? Next, we had a look at the characteristics or the clinical features, right? So by location, we have learned that about 1/3 of the cases, or about 36% of these defects, are present within the maxilla, and about 62% of osseous craters are confined within the mandible, right? So this is one of the most common bony defect which is seen, right? So next, we have also learned that these are more common in the posterior segments when compared to the anterior segment. That means the premolars and molars are more frequently affected as compared to our anteriors, right? Next, we have learned that in about 85% of the cases, the height of facial and lingual walls would be equal. That is, the amount of reduction in the height in these two would be equal, whereas in about 15% of the cases, the height of facial wall could be more, or vice versa, right? So next, we have learned why are these defects so common, right? So we had talked about three chief reasons for the high frequency of these bony defects. The first one was that interdental area is quite difficult to clean, right? The oral hygiene is quite difficult to maintain in that area. Therefore, it is a frequent victim of increased amount of plaque formation and plaque collection, leading to such bony defect. So the thing here to remember is that whichever type of bony defect might be present, be it any type, the chief reason would always be attributed to the increase in the plaque formation as well as collection in that particular area, right? So the next reason was that there is a slight concave facial lingual shape, particularly in the mandibular molars, right, which makes it quite susceptible to osseous craters. Third, we have learned that the vascular patterns from the gingiva towards the center of the crest of the bone makes it susceptible for inflammation. That is, the vascular pattern in that area is so tortuous, it is so coiled, that the inflammation might occur in that particular area due to alterations in the vascular patterns, making it more susceptible for crater formation. Next, we have learned like how to diagnose such a defect. So our chief modality of diagnosis is definitely IOPA, right? In IOPA, we can see there is a hollowing or a saucerization of the bone which is occurring, right? Next, and better alternative would be an OPG, right? So in the OPG, we can clearly visualize the saucerization of the bone which is occurring. Next, we have learned about the treatment modality which is undertaken for correction of this defect. That is, we have learned about the osseous resection surgery. So it comprised of four chief steps, right? The first one was vertical grooving. In that, with the help of burrs, we are placing vertical grooves, right? Next is radicular blending. So once we have placed such grooves, we need to even them out. We need to even the portion out of the bone, right? So that is nothing but that is radicular blending, followed by flattening of the interproximal bone. Now, whatever amount of interproximal bone is remaining between the two teeth, we need to flatten it out, right? Our overall aim of this resective surgery is that we need to make the contour of the bone even. We need to have the bone in the same plane for effective healing to take place, right? So after that, we need marginal bone which needs to be flattened, and we do it by gradualizing the marginal bone, right? So these are the four steps of resective osseous surgery which needs to undertake so that we can have healing of such defects, right? So that was all about the treatment part. So I hope I have made the topic very clear to you guys, right? So whenever a question that is a short answer question is asked for osseous crater, you need to start with definition. You will describe clinical features, you'll write the main reasons for crater formation. Then you can write about the diagnostic modalities followed by the treatment planning, and you can fetch full marks in that. Also, you can draw the difference between the normal bone versus a bone affected by osseous crater, which I have already put up in the video, right? So you can take that diagram for reference as well, and it is quite easy to replicate as well. So I hope you guys understood this topic very well. Thank you. I'll see you next time. Till then, this is Dr. Snehal signing off. Bye bye. Take care.